RA for literally 20 years. And they have managed our projects regardless of where we've been and done it very successfully. What I told the designers or the architects was that this is what I want. When you walk into this hospital, you just say, wow, this is not a hospital. That's what I want.
We spent time with focus groups. We went out into the community, spent lots of time with department leaders, with staff at every level in the organization.
We believe that design must respond to a hospital's business plan. So in this case, Capital Health had a very clear idea of what they wanted to build, and we helped them kind of figure out what their immediate goals were, what their long-term goals were, and help them kind of roadmap where they wanted to get it.
The first thing we did was establish the vision for this project, what we were going to do together to really change the delivery of healthcare in this community.
The design intent came from a very extensive visioning session with Capital Health, Anchor Health Properties, and all of the architects.
We were involved in overall design as one of the design partners, and we had the lead for interior design throughout the project.
I wanted this hospital built in a way that we could add to it without interrupting the infrastructure for additional phases.
As much as we can know about the future, we've tried to allow as much flexibility as possible. One thing we always know about hospitals is A, they're going to change, and B, they're going to expand.
I can remember getting into a debate with one of the architects about how the nursing part was supposed to happen, and I was thinking, wow, how does she know that? They take the time to learn about how the space is supposed to be used and not just how it's supposed to be built.
This project came to market at a time when the marketplace wasn't very receptive to healthcare or any kind of large-scale development.
So we became aware of a program with the U.S. Department of Housing and Urban Development, Federal Housing Authority, that endorses hospital projects.
There was a lot of meetings with HUD going through the plans with them so they understood exactly what was in the documents, that it met all the licensing information that's required from New Jersey as well. And
guess what? The next day before noon, that mortgage was sold, and one entity bought it.
Array has been able to create the ambiance of a healing environment so that it reduces the stress level of everyone who walks in the building.
We wanted to make sure from the moment you arrived on that campus you had the sense that this is a place that I will be respected, this is a place that I will be cared for.
the efficiency of the emergency department really comes from the way the nurse station is laid out so that they have visual contact of all the patient rooms, whether it's a peds or an adult room.
Evidence-based design and best practice truly inform everything that we do.
This hospital was committed to safety. All the rooms basically are same-handed and are the same designs.
We believe the Capital Health Center Hopewell is one of the finest facilities in the nation. We have been able to integrate not only excellent medical care, but also the healing environment, the amenities that both patients and visitors and staff need in order for them to do their best, and the art program that further enhances the overall experience of a patient or family member who comes into Capital Health Medical Center Hopewell.
The execution was incredible. This project came in ahead of time and under budget. This massive project, which is really unheard of, and I'm proud of their accomplishment.
Quality is something that's hard to define but very easy to recognize, and that was a big part of that wow experience, and having a sense that the environment supports these amazing clinicians that are part of the Capital family.